Hi guys, and welcome back to another female fitness and training video. Today we're going to talk a little bit about pregnancy and exercise. We're going to look at some of the truths behind it, what's a myth, what's real, and let's get the facts before you start exercising whilst pregnant. So one of the first most commonly thought about and asked about myths around pregnancy and training is exercise dangerous whilst you are pregnant for yourself and for the baby? And the short answer is no. The only reason that would be dangerous is if there are complications within the pregnancy or you have been advised against it by your doctor or your midwife. Exercising whilst pregnant will actually be beneficial for you as the mother and the baby. It will improve your mood because it helps release endorphins such as adrenaline, which will help release serotonin that makes you happy. It will also improve that mood because of those endorphin rushes. It's going to make you feel a little bit less fatigued. We'll go into that a little bit more in a second. And exercise also helps to regulate some of the other hormones within the body. So alongside serotonin and adrenaline, it can also help with things like gestational diabetes because of that hormone regulation. So where did the idea that training and exercise can be dangerous for you or the baby come from? Well, if you're someone who's never exercised before, adopting a new training regime would potentially be advised against. Now that's going to depend on a few things like the intensity of the exercise. It's going to depend on what your current fitness level is like, but there's no reason why you can't adopt that to a certain degree for yourself and where you currently are. So if you're someone who's never exercised before, you're not going to jump straight into a full-blown HIIT style workout. You're going to start slowly, increase your active daily lifestyle. So go for walks, do like housework, swimming, sometimes cycling can be good. That's going to be dependent on whether it's comfortable for you, but things like that are going to be much more beneficial than trying to jump straight into a heavy gym workout based routine. If you're someone who already exercises, you should continue exercising during your pregnancy. If you stop exercising, you may find a mood decrease, you may find that you feel more lethargic. So continuing with exercise, unless otherwise told by the doctor that you shouldn't, is a good thing. So continue with your routine. You may need to adapt around your exercises as you become bigger and the baby grows larger within you. You may need to change up your stance in things like squats, or if you're doing cardio, you may need to slow down a little bit, take a longer warm up, but you can still exercise well. Some other things to note when training whilst pregnant are things that I just touched on. Increased duration of warm up. So warm up for a longer period of time, start slowly and ease yourself in. If you only used to take 5 to 10 minutes before, try and take 10 to 20 minutes. Your body needs a slower amount of time just to ease itself into the exercise, lubricate the muscles and get the blood flowing, but without getting a spike in that core temperature. Stay hydrated. Because you have a fetus inside you, their body heat also increases your body heat. So throughout your trimesters, you may find your temperature increases, your skin may feel more hot to the touch, and you may sweat more. So make sure you drink plenty of water and avoid exercising in excessive heat as well. So try to stay as cool as possible, but you can still train. When you're exercising, you're going to want to avoid long periods of time on your back, and that is where we should avoid things like core exercises too. So you don't want to directly be working the abdominal muscles. You can do core focus exercises, but think about the core as a whole. So when you're doing bodyweight squats, if you're doing a wall push-up, or if you're doing something like tricep dips, the core is going to be engaged, but it's not directly impacting those abdominal muscles. If you are still going to train your core in an effective way, you're going to want to work with your pelvic floor, very important, especially for labor and post-pregnancy. And you're also going to want to work with breath exercises too. So utilizing that pelvic floor, expansion of the rib cage, and just gently contracting them back in, not with full force, but enough to just keep the muscles moving and engaged to support your back throughout your pregnancy. These exercises will also help post-pregnancy with things like abdominal separation. So they're a way to get yourself back into abdominal exercises and just encourage that abdominal wall back together, as over time the abdominal wall will separate to make room for the baby. Another frequently asked question surrounding pregnancy and exercise is, should I eat for two? Sadly, eating for two is somewhat of a myth. You do not need to consume enough food for two people. The truth of that is that from 0 to 6 months, so your first 2 trimesters of pregnancy, you don't actually require any extra calorie intake. You may feel a little bit more tired because obviously your body is working hard to create a little human being. So make food choices that are going to energize you, lots of fruits and vegetables, whole grains that are going to give you slow release energy versus maybe fast release carbohydrates and highly processed foods. But you don't need to eat any extra until you are in your final trimester, so 6 to 9 months. In that time, you do need a little bit more in terms of calories, but it is only 200 calories extra that your body requires. If you're not someone that's aware of calories, you might not be sure what 200 calories roughly looks like. So for example, that could be 2 medium-sized bananas, 1 plain bagel, 3 large broccoli heads, so 3 full florets of broccoli. You're also looking at half a can of baked beans, or something like 1 large avocado, for a few examples. Some women experience gestational diabetes, and that is something you do need to be wary of because of your hormone fluctuations. If you do eat too many calories and of the wrong sorts of food, it can lead you to getting gestational diabetes. So you'll have diabetes symptoms, and what that does is increase the growth rate of the baby. So long term, it's something that does need to be managed. Now that can be done with the help of exercise. So there's another reason to keep that exercise routine going and being active. However, gestational diabetes is not something that is solely caused by what you're eating. It is also caused by the irregularity of hormones during pregnancy. So don't beat yourself up if you do experience gestational diabetes, but do take action to prevent it or to manage it appropriately. And exercise is one of those things alongside good nutrition. And on the subject of hormones, exercise can also help improve your sleep because it will regulate relaxin, which is produced as you start to fall asleep. So if you're someone who's struggling with sleeping during pregnancy, of course, being uncomfortable because of the baby won't be helped with exercise and what position they're in, but it will help your quality of sleep. So all round, your hormones are going to benefit massively from keeping active. So we've got a lot of reasons that are pro exercising and pregnancy. But what are the cons, and when shouldn't you exercise? Ultimately, your doctor and your midwife will be able to advise you best as when not to exercise when pregnant. You also hopefully know your body pretty well, and if you're experiencing joint discomfort, pain in the muscles, which is different to muscle soreness or stiffness, those are signs for you to slow down and potentially stop if you're doing in-gym training, and maybe just adopt more things like walking, swimming, and less impactful exercises. Other reasons not to exercise are going to be pre-existing history of illnesses during pregnancy. So if you've experienced preeclampsia, high blood pressure, if you've given birth prematurely previously or have experienced miscarriages, those are also things to be very aware of when exercising. If you have experienced any of those things before, that's going to be something to talk to your doctor about before exercising or carrying on with exercising during your pregnancy. And finally, some of the other things to look out for would be severe anemia, so low iron, low blood pressure, and other similar things. So those are ones that you may need to avoid exercise with during pregnancy. Overall, exercise is pretty good whilst pregnant. So as long as you can keep going, do keep going. I've had quite a few clients now myself that have continued with exercise right up until their final trimester when they got a little bit too uncomfortable to carry on with training. Some of them were a little bit anemic and they had to slow down. But ultimately, it did improve their pregnancy when they continued with training compared to past pregnancies where they did not train. So if you can continue with exercise and being active, definitely do. And if you have any questions, please don't hesitate to come and ask. If I don't know the answer, I will surely endeavour to find out. Thanks for listening, guys. Hopefully this has been helpful for you. And if you've got any other female fitness topics you would like me to cover, please fire away in the comments. Bye.